So my name's Paul Litchfield and I chair the What Works Centre for Wellbeing. So I think most people get that they need to think about health and well-being in the workplace, but they don't really know how to go about it. So I think the biggest challenge is to get across to people that you need to have a structure. There isn't one thing that you can do that's going to solve all the problems. You need to have a coherent strategy that you follow in order to drive better health and well-being. And there are various ways to describe that, and it really doesn't matter which system you adopt, as long as you have a coherent strategy that you do follow and follow it for a protracted period of time. It's important because, of course, the health and well-being of your workforce is important. I don't know any senior leader who would not want his workforce to have good levels of health and well-being. But it's more than that, particularly where we are at the moment in the economic cycle. We know in the UK that we've got a productivity issue. Now, if we're going to solve that productivity issue, we can do it in various ways. We can put money into better technology, we can put money into education. All of those will have an impact, but they have a long lead time. What we can do and get a quick return on is putting money into the health and well-being of our workforce. And we know from the evidence that that will deliver rapidly significant improvements in our productivity. So particularly as we face the uncertainties in a post-Brexit world, we really need to persuade people that we need to all think about health and well-being of the workforce as a way of being a successful nation in the new world with a thriving economy based on thriving workers. So I think the forum has filled a gap that was there before, because it brings together a group of people from both the public and the private sector, together with academic people that are generating the evidence, and that's something that was missing before. So we have that blend of practitioners, but practitioners at a sufficiently senior level that they can influence policy in their organisations, together with people who understand the science and who are developing the research. And as it beds down and I hope starts to work even more effectively, we should see a virtuous circle where the businesses are feeding into the academics what is important to them, and that drives the academic agenda, and the academics are feeding the evidence about what works into the businesses, and that improves the performance of British industry.